Welcome to RadCentral, a radiology podcast, sponsored by Excalibur Healthcare. I'm Betsy.
And I'm Kiana. Today we have a special guest here with us, Dr. Robyn Roth, the Program Director of Breast Imaging Fellowship at Cooper University Healthcare, but you might know her as TheBoobieDocs. At MD Cancer Center in Cooper, New Jersey, she is board-certified radiologist specializing in women's imaging. However, she is a social media influencer on her free time. How are you doing today, Dr. Roth?
Thanks so much for having me. I'm so happy to be here. And I like to call myself a boobfluencer.
That is awesome.
I'm pretty sure I coined that term.
Absolutely. You are a very hardworking woman. You have over 50,000 followers on all of your social media platforms. You are a producer, a public speaker, an advocate to breast imaging health, and you have your own podcast, The Girlfriend's Guide to Breast Cancer, Breast Health, and Beyond.
That's right.
There is no limit to what you can do.
I mean, I don't sleep. And I also have 3 kids, and that's probably my most important job of all. But I really feel like I found something that I'm really passionate about, and it really drives me. And it's given me purpose outside of the reading room, and that's something really important to me.
Could you tell us more about your personal journey and what motivated you to not only be on social media, but to even enter the field of radiology?
I went into med school. I thought I wanted to be a pediatric endocrinologist, because I myself as a child had growth hormone deficiency, and my pediatric endocrinologist really played a big part in me gaining my confidence. I took growth hormone for years, and that was very, during the instrumental years, when, puberty. So that was really impactful as a patient. When I went to I got into med school. I went to med school at Albert Einstein College of Medicine, and there I realized that it was on one of my rotations. I realized that I had to be one step removed from patient care. I was a third-year med student. I was on my surgery rotation, and there was a patient that was newly diagnosed with pancreatic cancer. And we had several meetings with him, talking about the prognosis, that he probably didn't, unfortunately, have more than 3 months to live. And he was worried because he took care of his brother who was mentally handicapped. And so I became really involved in the social care aspect, trying to set up things like that. So, and I walked in the next day, and he coded overnight.
Oh.
And that really hit me hard. And it impacted me for several weeks. And I realized at that point that I needed to be one step removed from patient care, which is how I landed on radiology. While I was in med school, actually, my cousins were diagnosed with breast cancer in their 30s, and they were found to be BRCA1 positive. So in the back of my mind, I knew I always wanted to help women like them. And that's how I kind of landed on the field of breast radiology. And honestly, my platform kind of has evolved over time, thinking about them and wanting to help more women like them and more individuals like them. Is why I became so vocal about, sharing my story, sharing their story, and the importance of early detection. So it's kind of like a full circle. It's kind of all the stars aligned, and I love my career as a breast radiologist.
Absolutely. You took the words right out of my mouth. It's moving to see how something so small or even traumatizing could be pushed into something that's motivational, that offers determination for you to keep going with each and every patient. That brings up my next question, what impact have you seen social media have on patient education and engagement in your field of radiology?
I mean, it's life-changing. I mean, when I started this platform, it's funny because I started this platform, I originally started this in 2018. As a kid, I used to love writing, and I was missing something creatively. I was at that point where I was like 5 years in my radiology career. I felt like I hit all my goals. I had my kids, I had my career, and I just wasn't happy. Joined Instagram, and I started my platform, Dr. Robyn Roth. And that, I did nothing with it. I was really not having any inspiration. I was struggling to find my voice. I was like, am I a doctor? Am I a mom? I was kind of having this existential crisis. I think a lot of us have. And it was like 2 a.m, and I had my aha moment. Like realized I was surrounded by breasts all day and all night. And I was like, I'm a boobie doc. My grandma used to call breast boobies, and it's just kind of what I use to describe the term to my kids. And I changed the name to TheBoobieDocs. So this is interesting. The S is actually plural, if you notice. And it's because I actually work with my long-term best friend. I met her, Adrienne, I met her the first day of med school, day one.
That is awesome.
Yeah, it's really cool. And we've really impacted each other. Like she went into radiology because of me. She went into breast radiology because of me. Now we work together, 20 years later. And so I texted her. I was like, it's going to be TheBoobieDocs. We're going to be best friends that talk about, being breast cancer doctors and moms and all the things. And we did that together for a year. And that's really when it really took off. But she realized social media was not for her. Her dad actually was diagnosed with metastatic melanoma during this year, and he eventually passed away, unfortunately. And so at that point, she got out and said, it's all yours, which it always was. Like I was actually doing all the content under the guise of like, who is it? Like, I don't think I had enough confidence at that point to just put myself out there in such a way. But really, I needed her to be by my side, at least for the first year. And ever since then, I continued it. I've made it stronger. I'm more authentic than ever. And I just like sharing the entire process of being a doctor, being a patient, being a mom, all the things. And I think that's what people really enjoy about my platform, because I think being a doctor on social media is tough. There's so many out there right now. It's hard to stand out, but like people are getting their health information from social media. So we have to get on board. And I think what I do differently than a lot of other radiologists is I'm willing to step outside and show real experiences from me, the things that we are going through as doctors, as patients. I don't know if you guys saw, but last week I had a mammogram that was abnormal, that led to a stereotactic biopsy, that is PASH, that I'm going to get excised because they're calling it discordant. So all those things are exactly what people want to know, right? So every time I'm authentic, the content writes itself. And that's what I've realized through social media, is that we have the power to just be real with patients. They don't want someone in their white coat. The times are changing. They want realness. And I think that's what I give them that a lot of people don't.
Do they surprise you with some of the heavy vocabulary that they've learned?
Yeah.
And do they sometimes surprise you with just how much they know about their own situations?
I'm surprised about how much they want to know or how much they don't know, actually. I think that it's, I realize that there is this barrier or this big void between doctors, what we tell patients and what they understand. And that's where I realized that there was a big gap that needed to be filled they meet with their doctor, their primary care doctor, for 15 minutes. And their primary care doctor is probably not up to date on all the breast cancer screening recommendations the way I am, or understand when to use mammogram, when to use ultrasound or MRI. So I saw it as an opportunity, if you will, to jump in there and explain it directly to the patients. And they get to ask the questions that they would love to ask a breast cancer expert, but they're not going to meet me, and if they meet me, it's for 10 minutes and it's a very different situation. Whereas we're relaxed on social media, it's just for fun. We're just two girls talking about our breast health. And that's the vibe that I think people want. I read recently that I think 50% of young people get their health information from social media, and that's only going to increase. And I don't know if you've seen social media lately. There's a lot of misinformation.
Yeah. Are you concerned with people giving the wrong information?
I'm very concerned, especially with related to radiology. There are actually lots of accounts that say that mammograms cause cancer. Don't get a mammogram. It will kill you before your cancer will. And while they're trying to sell you something that is not approved to screen for breast cancer. So it's like a bait and switch. Like it's not from a good place. It's not like first of all, we know that the dose of mammogram is extremely low. It's equivalent to flying cross country, and early detection leads to better outcomes, lowers your mortality, less aggressive treatments. So we know that mammography is impactful. We're always trying to lower ways of radiation. And if there was a way to screen for DCIS or early stage breast cancer without doing mammogram, I'm all for it. But for functional medicine doctors to come out with thermograms or QT imaging and try to scare you away from getting something and then try to sell you something else, I have a big problem with that. And I think that patients, it's very, they see a shiny object. They're like, the doctors have been lying to us this whole time. Mammograms actually cause cancer. So now we're villainized for supporting science. And, whenever I comment on these types of things, they're like, you're just trying to sell us a mammogram. I was like, listen, I don't care what breast cancer screening you get. I just want it to be approved and know that we have data that supports that it's safe. It's really scary out there because you don't know who to trust, because some of these are doctors and but they've been sucked into the dark side of social media and medicine, realizing that, like, if I buy a QT imaging scanner for $400,000, and then I'm going to sell it to you for $600 a pop, I'll tell you to come back in 3 months. What are we doing here? And that's what's happening.
Do you think that with the platform that you've built for yourself, that it's almost like your responsibility to go and combat this information that's being spread all over social media?
It's so funny because I've been thrown into this thing of like, now I have to stand up for this. And I've been thrust into this, like, it's kind of getting center stage. I need more people out there, honestly, because the more voices that we have, the better. We want to screen early. I always say early detection is the breast protection. If I thought that QT imaging was the way to go, I would support it. I would learn to read it, of course.
For our listeners that might not know what QT imaging is, could you just give a brief explanation of what it is?
Yeah, so QT imaging is essentially a fancy 3D ultrasound. We've been using ultrasound for decades in radiology as a supplement to mammogram, but we know that ultrasound doesn't detect microcalcifications, which can be the earliest signs of breast cancer, which is why it's an addition to your mammogram. And even on the QT imaging website, it says this is not intended to replace mammography. So, number one, it's being sold as a false bill of clearance. So people are paying $600 out of pocket. They advertise it as offering no radiation, no compression, and 40 times the resolution of MRI, which I don't know where they're getting these numbers. And you would think that if a new imaging test was all the rage and it was that good, then the radiology community would be on board. This is actually being supported by functional medicine doctors who buy a scanner for $400,000, charge money out of pocket because this is not getting covered by insurance. It's not cleared to replace mammography. So it's a scary time out there, and they have really fancy marketing. And, they're really going on the fear mongering of radiation causes breast cancer. Mammograms have radiation causes cancer, so therefore mammograms are bad. ALARA, as low as reasonably acceptable. We want to always minimize the amount of radiation, but the amount of radiation that you get from a mammogram is incredibly low, and the benefits of early detection far outweigh the risk. Mammograms are not the problem. We're seeing a young breast cancer epidemic. Most of these people have never had a mammogram. So it's not the mammograms. It's really something, I think that we should be alarmed of the rise in young breast cancer. But at the end of the day, early detection is the breast protection. Early breast cancer detection leads to better outcomes, better mortality rates, better, less aggressive treatment options. So I think it's a really scary time to be out there. As a patient, you hear this stuff that is so shocking. Like, are all your doctors lying to you? Or is it, a few bad eggs that are really trying to make money on fear-mongering you away from getting a mammogram?
Not all heroes wear capes. Sometimes they wear bras in your case.
Oh, I love that.
Absolutely.
I'm stealing that.
But it brings me to the question of, I want to know your opinion on non-radiologists ordering these images to help their patients. There's not enough radiologists. There's too much of a backlog. There's more patients that are coming in looking for this medical treatment. So what's your opinion of that?
The problem is that women come in asking for it. They're saying, I want to get a QT imaging scan. I saw it on social media. Mammograms cause cancer. I don't want to get it. So I think that the providers have to have a conversation with them. I am pro breast cancer screening, whatever that looks like for you. If you understand the limitations of mammography and you decide QT imaging is for you, great. But I want you to know that, one, it doesn't detect the microcalcifications of DCIS. One, it doesn't get far back to the axilla and the clavicle area. Just because the way that the QT imaging scan is done, they're laying on their belly, their breasts are through the hole, they're in a water bath, which is old school ultrasound techniques. Like, I don't know where these numbers are coming from that it's so high resolution. And if it was, I think radiology would be on board. Actually, all the chatter in the breast radiologist community is like, what are we going to do about the QT imaging? Like, how do we stop this? And in terms of the radiology backlog, clearly we have to, there's more and more patients that are getting scans that need to be read. I do think AI will play a big part in the future of radiology. You definitely need a radiologist in this all. You need someone to synthesize the information that AI is feeding you and then work up the information, do the biopsy, deliver results. So until that, they figure out how to take us out of it, radiologists will always have a role. I always say that AI is not going to replace radiologists. Radiologists who incorporate AI will replace radiologists that don't.
Wow, that is a really good perspective to be able to see how, in the near future, however that may look like, we have to be able to adapt and live with it, and not completely negate it or allow it to take over and be the main act.
We can't feel threatened by it in the way that like we're going to be out of a job. If you're creative, if you're a good doctor, if you're a good radiologist, you're going to figure out ways to make yourself better with AI. And I think that's where we all need to be because it's not going anywhere.
There you go.
Right. And social media is not going anywhere, which is why I really do think that, we need more radiologists out there promoting our field, what we do, what a radiologist is. Most people don't even know what a radiologist is. So I think a part of my platform has been trying to get more radiologists out there providing evidence-based medicine.
What strategies can be adopted to ensure that breast imaging practices are optimized for accuracy as well as appropriateness for enhancing patient care while minimizing the unnecessary procedures or scans that are ordered?
I think people need to look more into their radiologists than they probably do. Okay. I think that people go to, you look up your surgeon, you look up your endocrinologist. Why would you not look up your radiologist? I think that it's important to, how long have they been doing this? Is this a private practice that, makes money? Is this an out-of-pocket practice that's going to make money if they give me a biopsy or if we do a diagnostic the same day? It's scary. You don't know. As being a radiologist, I read reads from all over the country. I see things that I don't particularly love. Most radiologists are great, but I do see things that I don't think are maybe in the best patient interest, and that's a hard place to be in. But I think that radiologists need to be, on the up and up because you represent the whole field. When there's a bad seed, it kind of ruins it for everybody else. But I'd say most radiology practices are well-intentioned.
Absolutely. I think like what Betsy said in referencing that this is a very scary moment when you're going to get your breast examined and possibly hear some not so great news that the next thing you have to now worry about is doing a full interview for all of the doctors that are now going to be involved. So I think having presence like you on social media can kind of bring that fear at ease, exponentially at that.
Absolutely. I think that part of my platform has been demystifying breast cancer screening, biopsies, breast cancer in general. And that's so important these days. And I think that's why I like, the authenticity piece of it is so important too. Like even when I had my abnormal mammogram, I was posting in real time because I was funny because I was getting my mammogram and the tech, she's like, stop filming. And I knew that meant she saw something. And I was like, I would show them anyways, either way, I'm going to show you. And like that, it was at that point that I'm like, no, we're doing this.
I think I saw that clip.
Yeah.
But I had the sound off because I didn't want to.
Yeah.
I was in the office.
Yeah. No scrolling at work. Right. But yeah, so I think that was really, an important moment for me, realizing that, we're doing this. Like even I'm going to get an excisional biopsy. I'm going to get a breast lift. I'm going to take them along because there is so much power in leading by example.
Important that all women understand the importance of a mammogram.
Yeah.
And that is the primary message of your social media.
Absolutely. Yeah.
But there seems to be a secondary message that if you are within the world of radiology, and this is a smaller sphere, radiology in general benefits from your social media because a lot of people don't understand that when they get that report, it's not coming from their primary care doctor. It's coming from a radiologist who might not even be on the same side of the country, and they're reading a report and letting them know that they might have breast cancer. saying it on social media and being a radiologist on social media, you're letting so many people know that the smarts behind the reports are coming from radiologists.
Absolutely. I do think that my platform has, given radiologists a voice and like a face, and also encourage other radiologists to do the same. Like I said, I think our specialty is in a little bit of danger because social media out there saying, radiation causes cancer, don't get these scans. We're going to have more and more people believing that. The Society of Breast Imaging says that all women should have a breast cancer risk assessment before the age of 30, ideally at age 25, so we can identify high-risk individuals that would benefit from starting, mammograms earlier and supplementing with MRI. Most patients never heard this. Most OBs never heard this, right? Just because the Society of Breast Imaging makes this recommendation doesn't mean anyone's going to get it. But then enter me. Now it's like all these women are going to their doctors and saying, I want a breast cancer risk assessment. The TheBoobieDocs told me, or she told me I can Google the Tyrer-Cuzick calculator. And now I know that I have a 22% lifetime risk of breast cancer. Now I'm empowered to go and ask for the MRI where maybe they wouldn't have known that. Maybe their OB just is old school and didn't realize that was a thing. So it's really cool.
And that's to some degree driven by you spontaneously showing up on people's feeds.
Yep.
Around, right?
Yeah. It's so fun. I'm always curious, like, why someone followed me. Like, what was the video that they saw? Was it me doing a silly little dance, or was it me doing a biopsy? Because I don't know how I land on someone's FYP page. I often do, and it's usually the ones you don't expect to go viral, right? But yeah, the amount of people I've had be like, I'm so happy I found you. I'm having a biopsy next week. I was so scared until I found you. Like, that is like the best compliment that someone can give you. And like, imagine just finding my platform and you're like, oh my God, there's so much information here about, I had no idea that this existed. And it's funny, I can realize when people are falling down my rabbit hole, like the 10 old videos will get likes. And it's cool to, know that I'm making such an impact. It's really the butterfly effect, right? And then they tell their friend to get a mammogram, or maybe it's not that bad. It's so funny. My dad saw one of my videos. Like, I think he saw my breast MRI, my MRI biopsy video. He was like, "You do that?" He's like, "I thought you were just sitting in a dark room reading all day." And I was like, "Yeah, that's the misconception. Like, even my dad doesn't know what I do. So imagine like my friends, So it's cool to show people, for the field of radiology, like what a radiologist does. And like, I hope to inspire more women in radiology. Like, and I think I do. I know that to be true. So it's cool that, like, it's funny because that was not the intention of my platform, but it's such an amazing side bonus of we're giving visibility, we're giving credentials, 14 years to train to be a radiologist, and we're doctors, definitely.
I did want to bring up some of the technology questions that are in the forefront of radiology. What advancements in breast imaging have you seen that you're very excited for in the near future?
So we've actually been using contrast mammography for over a decade. I think that's the solution for breast cancer screening, especially in patients with dense breasts. So for anyone listening, a contrast mammogram is like, I always describe it as like a mammogram and an MRI had a baby, and it's a contrast mammogram baby. It basically allows you to find the microcalcifications of DCIS, but also adds that physiologic component of the contrast. It uses IsoView 3, so it uses the iodine-based contrast, like CT scan, as opposed to gadolinium, which is in the MRI. So I think it's a milder contrast, and you're able to, background enhancement is so much less than MRI in my experience, and I really think it overcomes the limitations of dense breast tissue. Now we have contrast mammography with tomosynthesis, so it's like the 2D is actually a 3D mammogram, and then you have the contrast. So I really think that has improved our cancer detection a lot. We use it for, if you're going to call someone back who's it's going to be cancer, and you kind of order that to do as a staging study before they even have a biopsy, so you can get an idea of what you're dealing with in the breast. I think that's been really helpful. We can biopsy under it now. So I think contrast mammography is the thing I would like to see utilized more in the dense breast tissue screening, as opposed to a regular 3D mammogram. I've seen a lot of things about breast CT. I personally don't see the advantages of it other than no compression. But, I am a little concerned about the radiation dose, or what if they see something on a breast CT, how they biopsy it. So I've got questions there. But again, I think AI plus a risk-based screening approach is really going to be the way forward for patients and doctors, radiologists.
Hopefully that could be the new standard.
Mm-hmm.
Less invasive, less radiation, overall happy patient.
Mm-hmm.
That's the goal.
I saw something on your TikTok.
Mm-hmm.
It was talking about the 21st Century CARES Act.
Uh-huh.
And this is something that we've read about recently. Just to give you a brief look into our company culture, this podcast came out of us being required as staff to stay up on radiology news. I want to put words in your mouth.
Yeah.
The opinion you might have is that sometimes patients are getting a complex radiology report sooner than they can have someone explain it to them.
Absolutely.
And this CARES Act is not going away.
Mm-hmm.
Radiology reports have to give a good amount of technical information.
Mm-hmm.
What are some of what's in the future for that?
Yeah, I think it's, a scary place to be, where the patient gets the results are available immediately to the patient, which in theory is like a good thing, right? We don't want to delay a patient diagnosis. But I do think that there's this kind of sweet spot of like wanting to call the patient with cancer diagnosis before they read it in their chart. Mm-hmm. And I think that's where the act is lacking, is that, I wish that there was like a 2-hour delay so we can make the appropriate calls and make sure that they get some context of this. Like, I can imagine getting something on a Friday, not being able to talk to someone until Monday, sitting with the fear and the anger and the frustration and, trying to get someone on the phone. Like, that's a horrible place to be. Mm-hmm. So, I think that it's a tough one, because I don't know how, it's not feasible to call everybody, right, mm-hmm. with a result like that. So how do you get around that? So I think that my friend actually made this program called Cancer Besties, and you plug in your radiology report and it gives it to you in layman's terms.
Wonderful.
And it gives you some questions that you could ask your doctor. I think something like that would be great to implement with our radiology reports. Like, what does this mean for you? Like, is a hemorrhagic cyst something that I need to lose sleep over, or is it a very common benign thing that most women have, right? So giving some context to our diagnosis, or the words, like, right, that we write our reports for the doctor, not for the patient. So I don't know, maybe we should be writing it for the patient. Maybe we should incorporate some AI into layman's terms reports for the patient, if they are getting it this immediate where we go. I think that would be a really great service to offer people. So
that kind of ironically, it reminds me of the question that I have here, but I want to build off of that a little bit. So I have, how can investing in advanced radiology technologies and training help health systems address the challenges of imaging and improve the quality of breast cancer screening and diagnosis? You brought up your friend's software, which I think would be super useful, mm-hmm. but what other type of advancements or investments can be brought into the radiology field that will help minimize any of that confusion or delay?
I don't know. Like, it's a hard one, because unless you're having like nurse navigators that are working in radiology that are going to call every positive test.
Yeah.
Like, then where do you draw the line? Is it like, your cancer has progressed? Is that something that we need? Obviously it's terrible news, but I don't think a nurse navigator calling versus seeing in your report is going to lessen the blow. Easy solution there.
Maybe it's no easy solution. It's one of those things that we see that happen over time. Mm-hmm. They anticipate that the shortage will exceed by the thousands, tens of thousands by 2033. And who knows what's in store for that. But every day there seems like to be more progress in the radiology field. So, do you have anything else that you'd want to share with RadCentral?
Follow the TheBoobieDocs for more of the breast information.
Oh, you beat me to it. I was going to do it for you. But absolutely. Yeah. I think it was absolutely wonderful to have you come in, share your insights on social media, healthcare education, breast imaging, and ultimately radiology. You gave us a little bit of a secretive insight on that.
Said it all.
You showed up in person.
And I showed up in person.
I mean, I don't know how you find the time, but you do. You're here,
do.
and I really appreciate what you're doing for breast health. And thank you for coming in.
Thank you so
Absolutely.
much.
I just want to offer a reminder, be sure to go and tune in on The Girlfriend's Guide to Breast Cancer, Breast Health, and Beyond, available wherever you get your podcasts.